Welcome to BeautyRx Live. This is December 2012. I'm Dr. Neil Schultz. Of course, this is Viewer Question Week at both Derm TV and BeautyRx, third week of the month. On live streaming video, I'm going to answer your questions about BeautyRx skincare products and related skincare issues. BeautyRx skincare products are the same products that have been bringing my patients more beautiful, healthier, and younger-looking skin for over a decade. They are patient-proven, and they are just very, very well received, and they give you the beautiful skin that you want. They address the ageless issues of color and texture, which begin in teenage years and go on for the rest of your life. And they do it by stressing the daily use of three very important ingredients: exfoliants, sunscreens, and of course, topical antioxidants. If you have any questions for me, please go to BeautyRxLive.com, put your question in the chat box, and I'll answer the questions in the order that they're received. So let's get started. My first question comes from Carol, and she asks, what's good for blotchy skin? Well, Carol, it depends whether your blotchy skin is brown blotchy or red blotchy. So if it's brown blotchy, then you need to use a bleach. You need something to reduce the amount of pigment, the extra pigment that's being made that's causing the brown blotches. So I believe in hydroquinone-free peptide-based bleaches, and as a matter of fact, the BeautyRx Brightening Complex has 5 different peptides that, in 4 different mechanisms, help to reduce the amount of extra brown pigment you're making. But don't forget, if you're brown blotchy, the sun can make more extra brown pigment faster than we can bleach it. So it's very important to use effective sun protection every day, or you're not going to get ahead of the curve. And one more thing. The extra brown that you have on your skin, which is built up in layers and layers of extra dead cells that contain that brown, those extra layers of dead cells, they need to be moved. They need to be actually exfoliated. So it's very important to use an exfoliant every day. And of course, in BeautyRx, we have glycolic-based exfoliants starting at starter strength at 8% or 10%, and then moving up to 15%. So you really need to use sun protection every day, and every evening exfoliate and use a peptide-based bleach to decrease the brown. If your blotchiness is red, there still is no topical product that's going to effectively decrease your redness. You can cover it with makeup, but you're not going to reduce that red blotchiness from topical skincare products, not even from BeautyRx skincare products, and that's something you'll need to see a dermatologist for, because laser treatments are very, very effective at reducing that red blotchiness. We have a question from Mike. He says, how many times a day and for how long should you apply a warm compress to a nice, juicy zit? Great question, Mike, because that means you're actually controlling yourself and you're not going to pick at that bugger. So I would put a warm compress, washcloth dipped in warm water, wrung out halfway, leave it there for 3 or 4 minutes. You don't have to do it for a half an hour. And I would try to do that at least every 3 or 4 hours until it either comes to a head or it recedes. So great question, and don't forget, picking at pimples often doesn't cause scars, but it certainly does cause brown spots. And brown spots are what we've just been talking about in terms of the difficulty in reducing extra brown pigmentation. Sophia asks, is Finacea an exfoliant or a disinfectant? And if it's an exfoliant, how does it compare to AHAs? Well, Sophia, Finacea actually is probably a little bit better at bleaching brown colors than it is as an exfoliant. And its primary function is not for exfoliation. If you want an exfoliant, AHAs like glycolic, BHAs like salicylic, or my least favorite choice, which are retinoids, those are your principal exfoliants. Of course, benzoyl peroxide used for acne is also a type of exfoliant, but too irritating to actually get effective exfoliation. So Finacea really isn't an exfoliant, and I wouldn't call it a disinfectant either. It is a product that is helpful for various types of inflamed skin and rosacea. And again, I'm Dr. Neil Schultz. This is BeautyRx Live for December 2012. If you have a question, go to BeautyRxLive.com. Use the chat box, and I'll get to as many of our questions today as I can. Mary asks, do IPL photofacials have permanent results? Well, Mary, IPL photofacials are used to reduce browns and reds. Very similar to what we were speaking about for Carol with blotchy skin, because a lot of what the IPL photofacials do is to reduce both brown and red blotchiness. So through using different wavelengths of energy, it does reduce the redness, which is done by actually removing those extra blood vessels that are enlarged and dilated, and it also helps to remove the brown. The red and the brown that you've removed are not going to come back after your photofacials. But if the same thing that caused them in the first place is still operating, such as spicy foods causing redness, or extra sun exposure causing redness and blotchy redness, well, then it's going to come back. So the IPL can't prevent your next round of browns and reds, but the browns and reds that it's treated will not come back once the IPL treatment is finished. Mary asks, is it true? I read on the internet. And by the way, in terms of the internet, let me just give you a little bit of perspective. The internet is an incredible resource. But unfortunately, the internet has a lot of not necessarily accurate information. That's the whole reason we started Derm TV, to try to give you a good, credible, unbiased source of good information relating to skincare. I like to describe the internet when it comes to skincare and health in general as the greatest compilation of medical knowledge known to man, but relevant to none. And the reason it's relevant to none is because it's so hard for most people to filter what they're reading and to be able to interpret what they're reading and hearing, to be able to interpret what relates to them and what doesn't. That's why we have Derm TV. That's why we have BeautyRx Live, to give you good, honest answers. So Mary says, I read on the internet that anything with a pH over 8 promotes acne because it can cause bacteria, especially all soaps. Mary, that's not true. Products with a pH over 8 are very alkaline. They certainly are going to be irritating, but they will do nothing to aggravate the bacterial counts. They will do nothing to increase the bacterial counts either on your skin or in your pores. And in terms of soaps versus cleansers, well, we're actually going to discuss that in the episode tomorrow. But regardless of the pH of the soap, it's not going to have a bad effect on bacteria in terms of causing more bacteria. Obviously, all cleansers help to remove some bacteria, but that's not the answer. We need other treatments for bacteria. Roanne says that she's prone to spider veins. Can she use AHAs? Well, Roanne, you can use AHAs, but don't forget, one of the purposes of AHAs is to remove the extra dead cells on the surface of your skin. When you do that, it increases the luster of your skin and the smoothness. It makes it brighter, helps remove browns. But in removing that layer of extra dead cells on top, you actually get a little bit of a window into the skin. It makes the skin more translucent. So you can actually see through the skin a little bit, and you can actually see into the dermis. The dermis is where the broken capillaries are. So if your exfoliation with AHAs or anything else is effective, any broken capillaries that you have in the dermis are going to become more apparent. You're going to be able to see them better. The AHAs won't break capillaries. I think retinoids occasionally do break capillaries, but the AHAs won't break capillaries, but the capillaries that are already there may become more visible, and that may be a reason then to see a dermatologist who, with laser treatments, can remove them. Think of the AHAs in this case as sort of removing the dust on the surface of a painting. So you can see the details of the painting better, and the painting that we're talking about is in the middle layer of the skin in the dermis where the broken capillaries are. Teresa says, what's the pKa of BHA? I know you said the pKa of AHA is 3.82, and you get half the acid as free on the label. Well, Teresa, salicylic acid, which is the BHA, is not in equilibrium with a protein the way AHAs, the way glycolic is. So if there's no equilibrium there, then there's no dissociation constant, and therefore you don't have free versus bound. The BHA is all free, so there's really no pKa because there's no binding, there's no released free acid, and consider all of your salicylic acid as free and active. The problem is that unless you get it by prescription, the strongest salicylic acid you're going to get for facial use is going to be 2%, and unfortunately, that's not going to be strong enough for effective exfoliation. It will be helpful as a spot treatment for pimples and acne, and that's been its traditional role for over 50 years. We still recommend it, and we still use it. Mike asks, is there anything that's good for razor rash and razor bumps, and what's good to prevent them? Well, Mike, that's a big question. Actually, we did a Derm TV episode on that for Father's Day 2 years ago about the most effective technique for shaving to avoid irritation. So in terms of avoiding razor rash and razor bumps, which are two different things, let's start with razor rash. You want to shave in the shower. You want to wash your face with your regular cleanser at the beginning of the shower to get the oils off your skin and off your beard hairs, so the water and the steam in the shower can penetrate those hairs and soften them. Then at the end of the shower, you want to take a razor with several parallel blades as opposed to just a single-use disposable razor, which isn't sharp enough, and not sharp razors are going to cause more irritation. A sharper razor causes, paradoxically, less irritation. And with a shaving cream or a shaving gel, you're first going to shave in the direction of the grain, then you're going to rinse it all off, and you're going to reapply your shaving gel or cream and shave in the opposite direction. That will help to reduce razor irritation. When you're talking about razor bumps, you're talking about the little bumps that come from ingrown hairs. Well, if you want to get fewer ingrown hairs, it's probably best to shave only in the direction of the grain and not to shave, it's better to shave just in the direction against the grain and not with the grain, because when you shave against the grain, if this is your hair coming out of your skin and you go like this with your razor, it picks the hair up and has a chance to come straight across to give it a perpendicular profile on the top, which is much less apt to ingrow. When you're shaving with the grain and you cut across like this, you're creating a bevel on the hair, and then that hair, if it's oriented at an angle, when it pokes the skin, that little bevel has a greater chance of causing an ingrown. And the next thing that you need to do is to use an exfoliant to get rid of the dead cells that are helping trap that hair as it starts to ingrow and cause the razor bump. So at the opposite end of the day from when you shave, you want to use an exfoliant. I would suggest an 8% glycolic exfoliant because the skin of the neck tends to be kind of sensitive. I mean, you know about that in terms of shaving irritation. So shave in the shower. Use a shaving cream or a shaving gel. If your issue is just beard irritation, first with the grain, then against the grain. If your issue is razor bumps, then just against the grain, not with it. And in all cases, at the opposite ends of the day, an exfoliant. Again, I'm Dr. Neil Schultz. This is live streaming video, BeautyRx Live, answering your questions about BeautyRx skincare products and related skincare issues. If you have a question for me, go to BeautyRxLive.com, see the chat box, put your question in, and we'll get to it as soon as we can. Mary says that she lives in Vermont. She's using sunscreen on her face, neck, and hands. I wear long sleeves and layers, etc., on the rest of my body in the winter. And I think, I don't see a question here, Mary, but I think that certainly is going to be very effective sun protection because you're putting your sunscreen on all of the areas that are exposed to the sun. Just remember, one application of sunscreen in the morning isn't going to do it. You need to reapply sunscreen according to the amount of activity you have, the amount of perspiring you do, since you have to reapply it after you perspire. And even if you're not doing heavy activity and you're outdoors, you need to reapply it on those sun-exposed areas every 2 to 3 hours. And I'd like to thank all of the viewers today for really a really great set of questions. Wendy says that a friend of hers told her that a BHA peel of 30% is stronger and more effective than 70% AHA for even skin tone, wrinkles, and acne. Is this true? Well, I would tend to think not. I would tend to think that a 30% BHA, which is now a commercially available preparation, which is called a beta peel, that's very effective for brown discoloration and appropriately effective for exfoliation, but certainly for exfoliation, a 70% AHA, assuming that the pH is appropriate. A 70% AHA, meaning 7% glycolic, because that's the only AHA that you're going to get at 70%, is going to be better for wrinkles and is probably going to be better for acne. And again, for skin tone, the BHA is very good, but I don't know that we can categorically say one is better or one is worse. Okay, so Teresa says, so the BHA is all free even if the pH is over 4. Well, the pH is being determined by a lot of different things, Teresa, but the point is the salicylic acid is not going to be bound up, and whatever salicylic acid you have is going to be free, but it's really, it's a little bit of a complex chemical situation, and I think what I can best do for you is after the new year, perhaps we'll do a Derm TV episode on explaining exactly what's going on in the chemistry of BHAs. Beth asks, can glycolics make your skin more sensitive? If you're talking about sensitivity to irritation, well, it can make you more sensitive to irritation if the glycolic is too strong and causes irritation. But if you start at a low percent, like 8%, and work your way up gradually to 10% and 12 or 15%, you shouldn't get sensitization. If by your question you mean, does it make your skin more sensitive to the sun? Well, in theory, since you're removing that extra layer of dead cells on the top, which offered a small amount of sun protection, I suppose that an alpha hydroxyglycolic could make you more sensitive to the sun. But if you're using effective sun protection, which means a sunscreen with an SPF of between 15 and 30 with UVA protection, that is going to more than compensate for any of the dead cells that you've lost on the surface. And with that sunscreen, the AHA glycolic is not going to make you effectively more sensitive to the sun. Barbara says that she saw in a Derm TV episode that you can use super glue to heal cracked fingertips. Can you really use super glue? That's okay for your skin? Barbara, it works great. When you get cracks, especially on the tips of your fingers, which is very thick skin, one of the problems is that as a result of the crack, fluid or water from the dermis, the second layer of the skin, evaporates, and when that happens, the tissue shrinks and opens up more. More fluid evaporates. The tissue shrinks and opens up more, and the crack gets deeper and wider, and that's what causes the pain. Well, if you want to stop that process, you've got to seal the crack. So one of the ways of sealing the crack is to put a Vaseline-based ointment like bacitracin ointment or even a cortisone ointment on the very top. Seal it up so the moisture can't evaporate, and if the moisture can't evaporate, then it goes into the tissues, makes the tissue swell, and they come closer and closer together until it heals. Well, another way to do that, to prevent evaporation of those tissue juices, is with any type of plastic wrap on top of your finger, or a plastic coating like super glue. And the super glue is going to stay there for at least a week or 10 days until those surface cells are normally shed, as our surface cells always do shed, sometimes not fast enough, which is why we exfoliate, but as those surface cells shed, the glue that was attached to them ultimately peels off, and it could take a week, 10 days, maybe even 2 weeks, but it gives you very rapid relief from those painful fissures, as long as you don't mind walking around with those little strips of plastic on the surface of your fingertips. Mary asks if dermaplaning can be used as part of brown spot treatment. I would think that dermaplaning, if by dermaplaning you're talking about using a razor blade to just peel off dead cells, sure, it's going to peel off layers of dead cells. extra layers that have too much brown in them. If you're talking about derma rolling, which is a cylinder with little pins on it to make tiny holes in the skin, that is not going to is not going to help with treating brown spots. But anything that causes exfoliation, whether it's a razor blade from dermaplaning or a razor blade from your razor, or an exfoliant, anything that takes off extra layers of dead cells, is going to help you with brown spots. Just looking back to make sure we've answered some of these questions. Okay, so if you have any other questions, please go to BeautyRxLive.com. Use the chat box, and we'll be happy to answer them whenever we get them. If we can't get to them today, we'll try to get to them in our episode next month. And I want to thank you for all of your great questions today. Please keep sending your questions. I'm just scanning to see if there are any others. Please keep sending your questions. Don't forget that so many Derm TV episodes come from your great questions. Thank you again. I'd like to wish you all a happy and healthy new year, and we'll see you again in January. This is Dr. Neil Schultz, BeautyRx Live, and have a great one.